two general categories of colorectal cancer screening modalities. One is stool-based testing, and there's a variety of different ways that your stool can be tested. And then the other is visual exams, where the doctor will actually use either a camera or an X-ray to visually inspect the colon. There's a wide range of options for colorectal cancer screening, which is great. We know if patients have more options, they're more likely to complete a test. There's tests that you can do in your home that are inexpensive. There are tests that you can do that you only have to repeat every 10 years, and that really provides a lot of flexibility for the patient's needs. There are definitely some disadvantages to the test. Whenever you're doing the stool tests, they do need to be repeated annually with the fecal immunochemical fit test. With the multi-targeted stool DNA test, commonly known as Cologuard, you do have to repeat that every 3 years. And both those tests do require the patient to collect their own stool sample, which can be challenging for patients at times. Additionally, for the visual exams like colonoscopy, you do have to do a prep in order to clean your colon, so the doctor is able to inspect your colon for precancerous or cancerous nodules, which is time consuming, also a little bit messy, and then there's also anesthesia involved with the colonoscopy. So you do have to take time off work to go to the medical facility, and then you do need someone to drive you home after you've had the anesthesia. Both of those things can be big barriers for patients. So there's 3 screening tests that are very commonly used to test for colorectal cancer. The first is the fecal immunochemical test, or commonly referred to as a FIT test. This is an at-home stool test. The patient will get the test from their doctor, return to their home, collect a stool sample, and then collect samples of the stool with the test. They'll then return the test for testing and receive the results from their provider. Another commonly used stool test is a multi-targeted stool DNA test, commonly known as Cologuard. This is a test that the patient will receive at their home. They will have to collect a stool sample and then return the test to the lab via mail. This test is repeated every 3 years for patients. They can do it in the privacy of their own home, and it doesn't require any time off work. Another very common colorectal cancer screening is the colonoscopy. So colonoscopy is a visual examination of the colon that a doctor performs while the patient is under anesthesia. In order to prep for the colonoscopy, a patient must clean out their colon so the doctor is able to clearly see any cancer or precancerous polyps within the colon during the exam. This does include taking laxatives, which does cause you diarrhea and can be a little bit uncomfortable for patients, but is necessary for the test. This test is repeated every 10 years, which can be helpful to patients that don't want frequent colorectal cancer screening. So if you find something during a colonoscopy, one of the advantages of a colonoscopy is the doctor is able to either remove the cancer or the precancerous polyp during the examination, which can actually prevent cancer. If there is cancer found following the colonoscopy, then the patient can be referred for follow-up care. There's 3 other colorectal cancer screening tests that are less common but are still covered by insurance and available to patients. The first is CT colonography, where the doctor is able to use X-ray technology to take pictures of the colon. This test also requires the prep so that the doctor can get a good picture of the colon. And this test is repeated every 5 years for patients. During the procedure, there is air that is put into the colon, and that can be a little bit uncomfortable for patients, but it does not require anesthesia, and it does not require anybody to drive them home. Another less commonly used colorectal cancer screening test is a flex sigmoidoscopy. This is similar to a colonoscopy, but only looks at the lower region of the colon. This also requires the prep and must be repeated every 5 years. It also does require anesthesia, and you do need someone to drive you home. Another less commonly used colorectal cancer screening test is a high sensitivity guaiac-based FOBT test. This is a predecessor to the FIT test. So this test does require you to change your diet, as the test is used to detect blood in the stool, and diet can affect those results. A patient will collect multiple stool samples for this test, and it is repeated every year. And if anything is discovered, then a follow-up colonoscopy is needed for the patient. One of the most important things for patients and providers to know is that there are different test options for colorectal cancer screening, and a patient should choose the test that's best for them, whether that's a stool test that they can complete in their home or a colonoscopy. For patients that meet the screening guidelines, most of these tests are covered by most insurances. For folks that are not insured, there are affordable options with some of the stool tests that start at $20 to $30.